Most of us keep a small box of baking soda tucked away in a cupboard, ready for the occasional baking project or to absorb odors from the refrigerator. Yet few people realize that this inexpensive white powder, technically sodium bicarbonate, can do far more than lighten cakes or freshen stale air. In fact, some researchers describe it as one of the world's most underappreciated medicines, noting that it costs only pennies per dose and is readily available almost everywhere. Because it is so common, we assume we already know everything about it, but modern science keeps uncovering therapeutic properties that were either forgotten or never widely publicized. Used wisely, it can ease heartburn in minutes, soothe irritated skin, support oral hygiene, and even augment certain medical therapies. The key word is wisely, because its high sodium content and strong alkalinity mean it is not appropriate for every circumstance and must be dosed with care. One reason baking soda has earned a place in natural health circles is its ability to shift pH. Dissolved in water, it becomes mildly alkaline, able to neutralize excess acids both on the skin and inside the body. People with chronic kidney disease illustrate the potential. When diseased kidneys struggle to clear acidic byproducts from the bloodstream, metabolic acidosis accelerates tissue damage. A landmark trial in the Journal of the American Society of Nephrology found that patients who took a modest daily dose of sodium bicarbonate experienced a slower decline in kidney function than those who did not receive the supplement. The dose was small, about a half teaspoon divided across the day, yet it was enough to raise blood bicarbonate levels and buffer excess acid. Physicians emphasize that this approach belongs under medical supervision because too much bicarbonate can elevate blood pressure or cause swelling in salt-sensitive individuals. But the study shows how such a humble compound can influence serious disease processes. That same alkalizing principle explains why a baking soda drink has been a kitchen remedy for heartburn for generations. Heartburn occurs when stomach acid splashes up into the esophagus, producing a burning sensation behind the breastbone. While commercial antacids contain aluminum or calcium salts, sodium bicarbonate neutralizes acid instantly and leaves behind water, table salt, and carbon dioxide gas. Mixed in a full glass of water, a teaspoon can quench the burn within minutes. The relief is usually brief. Long-term reflux requires broader treatment, but for people who experience occasional discomfort after a heavy meal, it can be a safe, fast fix. Because sodium enters the bloodstream quickly, anyone with high blood pressure or on a sodium-restricted diet should limit how often they rely on this method. The versatility of baking soda also extends to skin care. Added to a warm bath, it helps calm itching and mild irritation, especially in conditions such as eczema, chickenpox, or post-sunburn sting. Its mild alkalinity counteracts the acidic environment that makes skin more sensitive, and its fine crystalline texture gently loosens dead cells. Many people mix a paste of baking soda and water to soothe insect bites or minor rashes, though dermatologists caution that long exposures may dry the skin, so rinsing after 15 minutes is prudent. Because fungi thrive in moist, acidic regions, such as between the toes, athletes have long relied on foot baths containing a handful of baking soda to discourage athletes' foot. Laboratory studies confirm that a 10 gram per liter solution inhibits many common fungal strains, reinforcing the remedy's scientific basis. Inside the mouth, baking soda performs double duty as a gentle abrasive and a pH buffer. Toothpastes that include it consistently outperform non-bicarbonate pastes at removing surface stains and plaque. Coffee, tea, and red wine pigments adhere to enamel when the surface is slightly rough. The fine particles of sodium bicarbonate polish those stains without stripping enamel. Meanwhile, by neutralizing oral acids produced by bacteria, baking soda slows the growth of microbes that cause cavities and bad breath. Dental researchers have shown that rinsing with a weak bicarbonate solution can reduce oral microbial counts and relieve the pain of canker sores. Because it is mildly abrasive, dentists suggest limiting direct brushing with plain baking soda to a few times per week and always using a soft bristled brush. Its benefits even touch the athletic world. During high-intensity exercise, muscles release lactic acid, causing the familiar burning sensation and drop in performance. When athletes ingest a modest amount of sodium bicarbonate an hour before competing, their blood buffering capacity rises, delaying the acidic fatigue and allowing a few extra repetitions or seconds of sprinting. A meta-analysis in the Journal of Strength and Conditioning Research concluded that short, intense events such as 400-meter sprints, rowing bouts, or repeated cycling intervals show measurable improvements after bicarbonate loading. Typical doses are around 0.2 to 0.3 grams per kilogram of body weight mixed into plenty of water, but beginners should start lower because excess bicarbonate can trigger stomach cramps or diarrhea. Because gout and certain forms of arthritis worsen when tissues accumulate uric acid or become inflamed, researchers have explored whether alkalinizing the bloodstream can ease symptoms. Baking soda water appears to make uric acid more soluble, encouraging kidneys to excrete it, and small studies hint at fewer gout flare-ups. Likewise, a 2018 immunology study observed that daily bicarbonate drinks in mice and a small group of human volunteers shifted immune cells toward a less inflammatory profile, suggesting potential relief for rheumatoid-type joint pain. These findings are preliminary, yet they highlight a fascinating intersection between diet, immune signaling, and chronic disease. Upper respiratory discomfort is another arena where baking soda shines. Gargling a warm solution can calm a sore throat by neutralizing acidic secretions and thinning mucus. Added to saline nasal irrigation, it helps break down congestion during colds or allergies, allowing sinuses to drain more freely. Pharmacists once compounded bicarbonate powders for such purposes. Today, homemade mixtures perform the same task at a fraction of the cost. Some of the most intriguing, though still experimental research examines baking soda's impact on cancer. Malignant tumors often create an acidic microenvironment that promotes invasion and shields them from chemotherapy. Animal studies show that systemic bicarbonate elevates tumor pH and, in some models, slows metastatic spread or enhances drug uptake. Though human trials are in early stages and dosing must be carefully managed to avoid metabolic alkalosis, the concept illustrates how a simple molecule might one day complement mainstream oncology. For all its advantages, sodium bicarbonate demands respect. Each teaspoon delivers roughly 1,100 milligrams of sodium, about half a day's recommended limit. People with heart failure, uncontrolled hypertension, or chronic kidney disease must consult their physicians before internal use. Pregnant women, individuals with severe gastric conditions, and anyone taking diuretics or blood pressure medication need personalized guidance to prevent electrolyte imbalances. Skin applications are generally safe, but a patch test is wise for those with eczema or very sensitive skin. Inhaling fine powder can irritate lungs, so steer clear of airborne dust if you have asthma or COPD. The lesson is clear. When used judiciously, baking soda can serve as an inexpensive, multitasking ally, from brightening teeth to buffering muscles to taming stomach acid. Yet its very accessibility can tempt us to overdo it or overlook contraindications. Treat it as you would any potent remedy. Start small, observe your body's response, and involve a healthcare professional when chronic conditions are present. With that balanced approach, this everyday powder may become one of the most versatile tools in your self-care cabinet, offering relief and support far beyond what you once imagined while kneading dough or freshening the fridge.